Okay, thank you. I have that Zoom look, right? Waiting for the screen to open up. We all have that Zoom vacant glaze. So, good morning, Wakefield, and welcome to our weekly COVID update. I will tell you right off the bat that next weekend, next Friday, being the 26th, we will not have a update that Friday because we will be at a Zoom clinic in Wakefield, God willing. So we won't have an update for that day. So just so you know. Well, anyways, we'd like to start where we always start. If we could put the chart up there on the incidence of cases in Wakefield, Brian, thank you. Congratulations again to the town. We keep lowering our incidence of positive tests. And in the chat there, you can see that you can view the entire state and how all our surrounding communities are. And I think that statewide, it's actually been pretty good. I think we're down to maybe 66 communities that are in the red, and we certainly want everyone to continue the best practices of wearing a mask, watching your distance, washing your hands, limiting your large groups and what have you. And because of that, we have dropped our positivity rate to right around 4%. And our average daily incident rate per 100,000 has dropped steadily. Just 2 weeks ago, we were in the red at a 5.46% positivity. So that's a pretty good 25% decrease in that. So congratulations to Wakefield. Keep vigilant. I know it's harder when it gets colder because you want to huddle and get together, but please, warm weather's coming. I thought I saw some 40s in the 10-day forecast, and please, remember to wear one of these or two of these to make sure that you stay safe. Looking at the map, you can put the map up, Ryan. Thank you. As you can see, Wakefield is circled in the blue there, and it's we do maintain our yellow status, as do our surrounding communities. And you can see there's still a few of our friends in other areas that are still fighting, trying to get down into the yellow and then to the green ultimately. And then hopefully we won't have to look at this map anymore in a while. But you can see statewide, this is much better. A few weeks ago, it was a sea of red. So this is much better. So again, congratulations. And I think that people are paying attention and people are trying. So that's really great on everyone's behalf. You can take that down now. Let's talk a little bit about what's happening at the state and national level before I turn it over to Ruth and then to Tom to talk about this. So Wakefield, the state of the Commonwealth of Massachusetts, is no different than the rest of the country. We are beset with supply delays of the vaccine. And as Ruth has always said, and we've backed her up, we can only administer the vaccine that we get. So if we don't have the vaccine, we can't do it. So I will tell you that the people will be getting calls over the weekend and emails that there may be a delay on your second shots for some people. Hopefully, and we are very hopeful that that delay will not be long. It'll be just next week, so don't panic. We're going to get it. There's just a delay, and that part of that is nationwide because of the snow in the Midwest and what have you. So sit tight, stay tuned. Many of you, maybe the majority of you, will be able to get in on Monday, and the rest, we're hopeful. We have it on order. It should be here next week for on Friday. The other thing that has happened is that the state has changed the way it's administering vaccines, and more than likely, I'd say practically definitely, Wakefield will not be able to do any more vaccine clinics other than the two that we have scheduled, and hopefully a second shot clinic after the 25th, because the state has decided that they really want to push everything into these mass vaccine clinics, and or the Wakefield clinic would be open to the entire state if we wanted to run it ourselves. So we are, that to me would be a huge undertaking. We'd have to be open 5 days a week and to run the whole state. And given the current supply issue, I think that's something that we're really very hesitant to do. And it would have to be all our surrounding communities would have to join in that, and that doesn't seem to be the case. So There's still places at Doubletree and Danvers, which isn't far, and a lot of people have gone there. And who knows, maybe the state will reverse course on that, because you know what, this group has done one hell of a job. And at the end of the day, we'll have given close to 2,000 people, 2 doses of vaccines. So hopefully things will change and we can continue to do that. But that's where we are, Wakefield. Let me turn it over to Ruth. Ruth, anything to add?
Thank you, Steve. Yeah, so anybody who receives their first dose next week will receive a second dose. So that is not in question. Everybody who got a first dose will absolutely receive a second dose. Not everybody will receive it on Monday, but everybody will receive a second dose. And the time frame is 6 weeks from Monday. So there's plenty of time within that 6 weeks. Obviously, it's not going to take 6 weeks, but everybody who gets their first dose on the 26th will get their second doses. So I don't want anybody to think that they will not be getting second doses.
Right. And actually, I think that just for the audience to really understand, the time frame is 3 to 6 weeks from your first shot. So if you received your first shot on the 1st, which everybody did, and you were a few days after the 1st, that's within 6 weeks, so you're fine. So don't worry about that. No one's going to get a shot in Wakefield 6 weeks from Monday. So just to clarify that.
So, and yeah, as Steve said, the state is going in a different direction. So there will definitely not be local health department clinics. So you may see some what they're calling regional clinics in parts of the state. But they're actually a mass vaccination site that are run by local health departments. And that is something that our region has decided that we are not going to continue with. And so, so we will not be doing flu clinics, yeah. COVID-19 vaccination clinics after the ones next week that are scheduled and their second ones. Let's see.
And I think part of that reason is that it won't be regional. It'll be the entire state.
Right.
And we just don't have the confidence or the manpower to do that.
Right. So, but besides, there's a lot of other things besides vaccination. We're still doing contact tracing. Our numbers are coming down nicely. And I know our communications director has information about that on the town website. So every week, our weekly total continues to go down, which is great. It's still a lot of cases, but it's a lot less cases. So we're definitely heading in the right direction. We continue to ask for the public's support when we're doing contact tracing. We are able to do almost all of our cases in-house now, not sending them off to the Community Tracing Collaborative, which is also really good. And we continue to do our other work like restaurant inspections and housing complaints and everything else. So actually, the vaccine clinics have been basically all consuming. And so we will have the opportunity to be doing our other work again also. So.
Great. Ruth, great job. I know your staff has been worn out on this, but great job by you. So thank you so much for all your hard work.
Thank you. It's a team effort.
Absolutely. Tom, any words of wisdom?
I just wanted the emergency management's just been working on getting the clinic site prepared for the next round of shots. So that's what we're concentrating most of our efforts on. Also, I just want to make a message, part of my job is safety for our community. And as people are starting to become inoculated, I don't want them to feel that they now have a license, the freedom to just go and do whatever they want to do. There's still protocols and practices that are going to be set up. And I feel that probably in the next week or so, us in the town will be sending out a message quoting what the CDC is recommending for people who are inoculated to carry through, which would probably still be masking and all that other things that are required. So, but I just want people to understand that just because you got your shots doesn't mean that you now have the freedom to do whatever you want to do. So,
Thank you. Thank you, Tom. That's a really important message. And as more of the population becomes vaccinated, that also messaging will be coming out also from the state.
Great. Thank you. Thank you, Ruth. We're lucky enough to have two town councilors on today. Chair Santos, do you have any words of wisdom?
No, I have 0 words of wisdom, but I have a question. So I'm not so politically naive to understand the state's shifting to mass vaccination sites and what some of the reasoning is behind that. I also feel like they don't get pushback often. Is it in what I think is lost in the decision? And I appreciate that they're maybe what some of the reasoning is. But I also think that a 70-year-old person from Wakefield is not going to hoof it to Gillette. They're certainly not going to go to Fenway. Who is going to go to Fenway right now? No one's going to ride the T. I mean, maybe some people, but does it make any sense for us to just drop a letter saying, hey, we were successful. We were taking care of a vulnerable population in our town who could get to our town very easily. And now you're potentially causing that population to perhaps not get vaccinated.
So I will say that their reasoning is that for most of the state, they were getting 100 doses at a time. And they did not feel that that was the most efficient way to get the most vaccine out to the population.
Sure.
So they are open to having what they call these regional clinics, but they're mass vaccination sites run by us instead of the state. And the group of mayors and town managers felt that there was no advantage to our population to us running a clinic that was open to the entire state.
Right.
Now, I know that the Mass Municipal Association has written a very nice letter to the governor and lieutenant governor asking for them to reconsider. But I respectfully have to say that the system that is in place right now, the state system, has caused, there are so many issues with it,
Right.
that from a local level, it has been a nightmare. And the clinics themselves have been fabulous and they've run smoothly and they've been great. But everything leading up to that clinic has not been. And until the state can have a software system that works and a 211 helpline that works and makes appointments for people at the appropriate clinics, not a regional clinic, it really is not to our advantage.
Okay.
But I do think that we will consider that, because I'd love to be able to continue this, because it was a great for our surrounding communities here. But
Right. And I think it's pathetic for Massachusetts to be this incompetent. That's just my thought.
no,
So people need to take some responsibility and accountability. Maybe this is not something that's new, or surprise, not new, I should say, a surprise. So anyways, thank you, Ruth, for that feedback. If there's anything you need us to do from the town council in a nice, lovely, respectful way, I would certainly do it. So
and the way it works now is really the entire coalition, Malden, Medford, Winchester, Stoneham, Melrose, Wakefield. We're all in this together, so we'd all have to agree to it. So that's
okay.
hard process.
Sounds good.
Maureen had her hand up, then she put it down, but maybe it got tired.
Oh, I think no, I was clapping about what Anne said about just what a fabulous job you've all done, and I'm just going to echo that and also feel the failure of the state website as I try to register both my parents, and it was
Oh.
just, the level of frustration. It's been a mixed blessing where you hear about how frustrated people are with the administration and the state website. But then I get glowing reviews about everything you're doing in town every single time. I've been getting, I need to start forwarding them on, but Ruth and Tom and Steve, everyone's just done such a great job. So, I'll get these little emails of we went and got our first dose and it was so nice and thank you so much. And, I tried to volunteer and Rick didn't want me to volunteer. So like, I feel like I had nothing to do with it. So, so I do. And I know the calls as people's frustrations on the website go higher. I know you guys are getting more calls, so I appreciate you dealing with all of that. So two things is that I know I hear about being coordinated, Steve, with the surrounding communities. I do think it's like a best practice that we should share. And next week, the legislature's bringing in Mary Lou Setters, like Secretary of Health and Human Services, just to chat with her about the failures. And I think that's an opportunity to kind of tell, Senator Lewis and Kate and Donald about like, look, we did it really well. And like, as we get to everyone under 65, the general public, let's think about getting us more. So I do think there's an opportunity. And I know you talked to, Paul and the other town managers, but I just think there's an opportunity for us to weigh in about we've done it okay. And then the other thing I just want to say is to go to just build off of what Ruth said. So this morning I went to town hall and I was waiting in line just to go in the morning. And the two men in front of me were not happy about still having to wear masks, even though they were vaccinated, and I let them spew. But there is that anger, right? And it's been a year. I get it. We are all pandemic fatigued. And I didn't, want to debate them, but they were just angry about when things are going to go back to normal. And I'm vaccinated. Why do I still have to? Very angry. So I, as much as we can, and I'm looking at Jen in the center square of just that communication that we take from federal or state and just get it out there, because the anger is not pretty, and I think like life isn't going to change a lot once you get vaccinated, right? Except that you're not going to die. And that's a pretty big thing. But these two men didn't see it that way. So anyway, just my little, I don't know if they came and saw you after, Steve, but
No, they didn't, but they probably have in the past. They didn't today anyway.
Yeah. So anyway, just what Ruth said about, I think there's education as more and more people get vaccinated that you can't, we're still going to wear masks because not everyone is. And yeah, just that.
Thank you. Thank you for going on today. Anything else from everybody? We don't have the schools today, but that's okay. They seem to be copacetic over there. Oh, Ruth.
Thank you. I wanted to just go back to what Maureen was talking about, because I think what we've all been experiencing in all different parts of our work and life is that a year into this pandemic, it has taken its toll in many ways, but in some subtle ways that we need to remind ourselves. We've all seen tempers flare in no matter what it is, whether it's in your own family dynamics or work dynamics or out in the public, at a business, whatever, that we need to remind ourselves that everybody is very fatigued and frazzled and stressed, even if they don't necessarily, see it in the front of their brain. The back of their brain is very stressed, and the whole population is that way. And we all need to kind of take a deep breath and a step back and put a smile on our face, even when we don't necessarily feel that way, because as a community and beyond, this has been a very long year. and it's not over. So just a reminder for everybody to remind ourselves of that and to try to be kind.
Absolutely. Good words to live by every day, not just during this time. Anybody else? All good? Jen, anything you want to add?
No, but to Ruth's point, and on a positive, Ryan, if you want to put up the chart, there's the average daily case count that Ruth was mentioning was really on a good downward trend. So we can end on something positive here.
That's great. That's wonderful. Yep. Good. I'd like to see the curve in that way for this anyway. Well, great. Everyone stay safe this weekend. To all you kids out there, enjoy your last weekend of school vacation. Please don't drive your parents crazy. And we will all catch up with you, not next week, but 2 weeks later. And remember, please, wash your face, wash your hands, wash your face, wear a mask, watch your distance, and stay strong. Thank you, everybody. Have a nice day. Bye-bye.